Welcome back. Now to complete our discussion on kidney disease, joining me again is Dr. Charles Foulks. He's the chairman of the Department of Internal Medicine here at OU Physicians in Tulsa. Let's jump in, doctor. Now, I want to focus this segment on chronic kidney disease. Tell us exactly what is chronic kidney disease?
Chronic kidney disease means that you've had some damage to your kidneys for whatever reason, most common in this country being high blood pressure and diabetes. Chronic kidney disease is divided into 5 stages. Stages 1 and 2 are extremely mild and you generally don't have to worry anything about that. But stages 3, 4, and 5 are very serious. Stage 3 is where we begin to see the kidney not being able to manage the calcium properly. You may begin to have some difficulty with a low blood count, red blood cell count, because you don't make enough of the hormone that tells you to make blood. This is where we see you begin to have trouble handling salt. You'll get salt retention, which will make high blood pressure worse. And this is where we intervene with dietary treatment for chronic kidney disease. A lot of people ask me, well, doc, I urinate the same amount I always have. It looks normal to me. How can I have kidney disease, but yet I urinate normally? And the way I explain it is this, is when you have normal kidney function, you can do anything. So think about it as like buying a shirt. Go to Dillard's to buy a dress white shirt. You spend $49, $50 for a dress white shirt, you get a really good dress white shirt. That's normal kidney function. Okay, let's go to Kmart to buy a white shirt. You buy a white shirt for $19. It's good, it's okay, but it's not like the $50 shirt you bought, but you get by with it. Now, let's go to the flea market, to the bottom of the bin, and buy that white shirt down there for 50 cents. Man, that's not much of a white shirt, is it? Well, the kidney, urine is like that, and the kidney is like that. When you're normal, it's like that really wonderful dress shirt you got, and boy, when it's no good, it's down here like this other shirt that you got. But it's still a white shirt.
And for most of us, we don't often pay attention to our kidney function, or in terms of, are we really urinating, for instance, as much as we should compared to our intake and things like that. We don't really monitor that.
No, we don't, and it's actually not that helpful, quite frankly, because we're a society that is used to drinking fluids with every meal, whether we're thirsty or not, and everybody in the world is carrying around a can of Coke or Pepsi or tea or water or whatever. We drink all the time. If you really want to have an idea about urine output giving you a clue as to kidney disease, if you're getting up in the nighttime to go urinate and you didn't drink a lot of fluid just before you went to bed, you might have a problem.
So sort of switch our view, not what we're drinking in the day, what's happening, but what's happening to us at night.
That's correct. In fact, one of the questions I use to give myself a clue as to when the kidney disease started is I'll specifically ask, do you get up at nighttime to urinate? If so, how many times? When did you first notice that? And I can actually figure out about when the kidney problems began with that set of simple questions. The problem with kidney disease is it's a silent disease until it's very far advanced and you're in advanced stage 4 or stage 5 kidney
And that's what
disease.
I was going to ask you too, in terms of in general, when do most people tend to come to you?
Unfortunately, we don't get to see them until they're stage 4 and stage 5, and that's when most of the kidneys have already been destroyed. We don't have much that we can do as nephrologists except get people ready for dialysis, and that is very frustrating for us because we have so many things that we can do much earlier that will let you save your kidney function so that we can keep you off dialysis. My goal is to keep you off dialysis. I don't want you to ever see a dialysis unit in your life, or ever think about transplantation in your life. My goal is to keep you off. I need to see you early.
Now let me ask this question then to help us understand what's happening to us so we can get in early. You talked about how frequently we are urinating at night, and we're not relating that to the fact that we consume some liquid. We didn't consume anything, but yet we're getting up urinating. What are some other things we should look for? And then on a yearly checkup, should kidney function be checked, or what should we make sure our doctor's doing? So tell me about those things that we can do and we want to make sure our doctor's doing.
I think at least on a yearly basis, if you're an adult over in your 30s or greater, you need to have your kidney function checked once a year. It's a simple blood test called a serum creatinine. Your doctor can put it through a mathematical calculation. It's very simple. You can go onto the web and do it literally like that. It's that fast. And it will let you stage what level of kidney disease you have, or if you are totally normal. That's the single most important thing you do, is to talk to your doctor and say, what is my serum creatinine? What is my eGFR? eGFR is the phrase that we use to tell us what your kidney function really is.
eGFR.
eGFR, estimated glomerular filtration rate. eGFR.
Okay.
In fact, you know, go to Google, type in eGFR, you'll learn more about it than you ever wanted to know. But that's what you need to know. Unfortunately, the kidney disease is extremely silent until it's very far advanced. When you start seeing those symptoms, you're really in trouble. That's, you know, chronic nausea, the smell or sight of food turns your stomach, makes you sick. You're up all night and can't sleep, but you sleep all day. You're irritable, you forget things, you become clumsy, you can't balance the checkbook anymore, your handwriting. Well, my handwriting's not necessarily so good, so we won't go there.
Right.
Yeah, but you know, those are the sorts of things that in very advanced kidney failure that we look for.
And is that because of the toxin buildup in the body? And
yes.
Okay.
That is absolutely correct. The toxin buildup that's in the body, and that's what we do with dialysis, is we remove those toxins from you.
Okay. Now we have two kidneys.
Yes.
So people may wonder, well, do both of them get affected at the same time, or can one carry me? How does that work?
In looking at disease, problems like diabetes, high blood pressure, those sorts of things, it damages both kidneys the same.
Okay.
So if you've got damage in one, you've got it in the other. The only time we see damage to only one kidney is when there's a problem with the artery to that one kidney of closing off, or the drainage to that one kidney is blocked off. But otherwise, the kidney diseases will get both kidneys exactly the same. And you know, we all have some what we call renal reserve. Our kidney function, my kidney function happens to be normal because I know what my eGFR is. My kidney function is normal.
Okay.
I actually have some reserve kidney function that I can call on if I become stressed by a serious disease. God forbid I should drive home tonight, you know, run into a tree, end up with surgery, etc. My kidney's got some reserve to handle that kind of stress for me. But as you lose the kidney function, that reserve disappears, and you lose the function across the board.
Okay, thank you so much, doctor. I know that was fast and furious, but we know about the serum creatinine to make sure that your physicians are doing that, and your ECG.
Your eGFR.
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 It just starts saying alphabet soup, and you don't know what you're talking about.
If you'll just say GFR, you're close enough.
That's
you're
even better. Thank you so much for joining me.
You're quite welcome, Pam. Glad to be here today.
Thanks. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your comments, suggestions, or questions about future shows. Please email me, or let's start with writing. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150, or if you're on the email trail, now email me at healthalertusa@gmail.com, and also visit me on youtube.com/healthalertusa. Take care, and remember, talk with your doctor, make sure you're getting your yearly checkups, know what your kidney function is, and take care of yourself. This program would not be possible without the support of OU Physicians in Tulsa.